One morning, woke up, went to the toilet, got all dizzy, ended up collapsing on the floor. Rushed to hospital. That's when I was diagnosed with stage 4 cancer, with bowel cancer with a secondary in my liver.
So you might feel a whole load of different emotions. You might feel numb, you might feel nothing, you might feel confused, you might feel angry. And the benefit of having access to psychological medicine is that you've got an expert in mental health who you can turn to and make sure that you are supported throughout your whole treatment.
Having treatment is really scary, and that can escalate relatively quickly, and psychological support can help you manage the anxiety.
If a stress doesn't go away, it can over time start to build up, can lead on to depression, and that's not a very good place to be in, because when somebody's depressed, it can feel as though nothing's going to get better.
The questionnaire is normally sent out to you electronically, either directly to your mobile as a text message or to your email. If you don't have mobile or email, then one of our admin assistants will phone you to complete it.
Everybody's offered the exact same opportunity to get the support. Even the people that might not realise that they need the support will get offered the opportunity to talk to somebody and be screened, so it's fair across the board.
We ask you about your symptoms, and also alongside that we ask you about your mood and how you're actually coping with something that could be very stressful, which is your cancer diagnosis and treatment.
We will submit the answers that are given by you onto our system, and it will calculate a score. We will then upload that onto your electronic patient record so that the doctor can see it when you have your appointment as well. And if you score above a certain amount, one of our nurses or occupational therapists will give you a follow-up call in about 2 weeks' time, just to ask you a few more questions about how your symptoms have been over a bit of a longer period of time, and just get a bit more detail and see if there's anything else that we need to follow up on.
We usually make sort of about 3 attempts to call you. If we're not able to get in contact with you, we will send you a letter explaining our service and inviting you to get in contact with us so that we can complete the assessment.
The follow-up telephone call in some ways is a diagnostic telephone call. So that will tell us if we think you meet the criteria for a diagnosis of, say, depression or anxiety or any other sort of psychiatric condition. And if that is the case, we then can decide on what kind of treatment would be best.
Everything is easier dealt with when it's still small. You know, a cancer is easier to deal with when it's small. A psychological problem is much easier to deal with when it's small.
A number of the symptoms of depression are very similar to the symptoms of, say, cancer that's progressing. And very early on, you'll get to see an expert who's then able to make a definitive diagnosis and direct you to the exact treatment that we think is most appropriate.
Your whole normal thought process of being able to act responsibly or reasonably just went completely out the window, and you just went from 0 to straight away, and it was like to being able to dial that back down so you can actually then start to think about what was happening and then be able to act like any normal person would act, put it into perspective, where I'd lost that control of that really.
We will jointly make some recommendations, which could include some psychological interventions, which could be purely behavioral, as well as reducing some of the medications which may be driving some negative effects on your psychological health.
We generally have 10 sessions. The first session is all about getting to know you, and that gives us a way of being able to start to tailor what kind of treatment is coming after that. We offer problem-solving therapy, and we offer something called behavioral activation. One of the things about talking therapy is it sets you up. It actually gives you the skills that you can use going forward.
Each session lasts about an hour, and we usually meet about every 2 weeks. So we're very much focused on the here and now. It's not just general talking. It is a space where you can be heard and listened to, and that's really, really important. But we do try to sort of have something for you to go away and change.
It was really helpful to be able to put it all into individual segments, break it down, so then it was a lot easier to deal with rather than dealing it as one big issue, and it's like breaking it out into little bits, and then you could like chip a little way of each one and then gradually lower me like my stress levels down. I can always remember the big smile and the relief that I felt coming out of the sessions and that drive home. It was like a massive weight lifted off my shoulders.
It's really important that we're all working together because it enables smooth communication between all the teams, and that only positively benefits you.
As your treating clinician, I'm able to see what your psychological health questionnaire reports are, and the psychological medicine team, if they do see some concerns from those screening questionnaires, are able to see from the same record as to what treatment you're having and what may be driving some of these concerns that have come out of these questionnaires.
We have an IT system that allows the hospital to access your records, where you've given permission for us to share those records, so that the hospital, both oncology and psychological medicine, can see that shared care record. And if there are times where you feel that you're struggling and you might come to see me and you might tell me that you're having a difficult time and you're worried, or I might be worried, then I can contact psychological medicine directly and flag that you might need some additional support.
If you need antidepressant or any other medication, we'll talk this through and also have a discussion about what would be the best medication for your particular circumstances and symptoms. And there are various different classes of antidepressants with various modes of action and various kind of side effect profiles. We would choose the ones that we think are most likely to be of most benefit to you.
The antidepressant medication, many people do find it does really help, but not everybody wants or needs to have it. It's certainly not compulsory, but we will talk to you about that and about the potential benefits and any difficulties or concerns you may have.
The mechanism for prescribing a medication is that the cancer centre would make a recommendation to me about what antidepressants you might need and the dose, and then I would prescribe them and make sure that they are dispensed from your chosen pharmacy in the community. Now, sometimes you might come away from clinic and have questions afterwards, and it's absolutely okay to come and see your GP about that. And if I'm not able to answer those questions, then I can always get a second opinion from psychological medicine.
We send out the questionnaires at regular intervals. We do take referrals as well. So, for example, from the doctors or the nurses that work with you, if they have concerns that your mood is low, they do sometimes also refer directly into us.
Patients have fed back that they really like the fact that we're there throughout their journey, and that they found it really comforting that service is available to them, and they know that they can reach out to us if they are struggling or things change. They can reach out to us and we can always action that as well.
You'll get this text message, which then leads you on to the screening questionnaire. Please fill that in, because that helps everybody in the cancer centre. And if anything is becoming a problem, we're able to step in and do something about that fairly quickly. This is not just something physical. If it's something to do with something that's worrying you, please speak to your specialist nurse, because they'll be able to link you up to the right support.
If you ever have any questions or any worries, I really just encourage you to get in contact with your nurse so we can help guide you through that. We don't want you worrying at home, so always encourage you to get in touch.
The more information that we gain from you, the more of your voice that's integrated into how we operate will mean that we are providing you with the right interventions, both for physical cancer care as well as for your mental cancer care. We believe that we can do the best for our patients, and that's the promise we give you.
And it's important that we focus in and make sure that we give you the right treatment that's actually going to make the depression better. And also ensure that once the cancer treatment's finished, that the patient can actually go back to functioning, doing everything that they used to be able to do.
There's no silly questions. So if something's worrying you and you don't know who to turn to, you can always come and see your GP. Don't feel alone. Feel that we've got your back, both here at the surgery and through psychological medicine.
Probably like quite a lot of males really, we don't talk about our feelings, we don't cry, we think it was a sign of weakness or something like that, but it wasn't until you actually hit rock bottom and then you're brought back up from like the depths that then you sort of realise it's actually, we do need help and support, and we should grasp it with both hands however we can get it, really. And without the psych team, I would just be a body that's been sort of like repaired. We're all individuals and it's all our minds that makes us individuals, and without repairing that, you've only done half the job, really. Everybody that I've dealt with there has been amazing. I class myself as being very lucky.